Good morning and welcome to the second time only in our association's history where we've done a chapter meeting by satellite teleconference. We'd like to thank our Bureau of Health Promotions and our video communications folks for allowing us the time on the satellite today to discuss some important topics in environmental health. We're going to be here today until noon. We're going to have three very important topics today that we're going to cover. We do have a 1-800 number that if you have some questions, please give us a call in toward the end of each presentation. The number is 1-800-946-6307. We also have questions that we can take by email. If you will go to the adph.org/ALPHTN, and there's a link there to send questions in. We have someone monitoring our computer to make sure that your questions that are emailed in will be answered promptly. I'm Tim Hatch. I'm the current president of the Alabama Environmental Health Association. I thank you for your time today. We have 5 locations that we're broadcasting to across the state. We have the West Central chapter meeting in Birmingham. Welcome. Southeast is at the Montgomery County Health Department. Southwest is down in Bay Minette. East Central in Anniston, and then our northern chapter is meeting there at the Madison County Health Department. So thank you all for attending today and for going through the registration process. And like I said earlier, this is the second time that we've done this, and we found it probably a good idea to help our speakers with the travel time and cost associated with them going to each of the 5 chapters. Now, when we meet again for our late fall chapter meetings, we'll go back to our standard format of meeting in a location together with speakers there on site. We'll talk about that a little later. Right now, I'd like to introduce our speakers that we have for the day and to give you a little idea of how we're going to conduct the training for the next 3 hours. We're going to have an hour session followed by a 10-minute break, then another session followed by a second 10-minute break. If you all would like to have some refreshments or take care of email or calls or any other business that you may need to attend to. But first, sitting immediately to my right is Ms. Phyllis Finn. Phyllis is with the Bureau of Environmental Services. She's an environmental supervisor there, and she's going to be speaking to us about the Cottage food laws that went into effect a couple months ago. Then we have our President-elect, Ms. Hasky Bryant, from the Jefferson County Department of Health. She's going to be giving us a recap of the National Environmental Health Association conference that she attended on our behalf in Las Vegas back in July. And then last but certainly not least, Ms. Phyllis Martis will be here to give us an update on the environmental computerization program. Phyllis also is with the Bureau of Environmental Services and serves as an environmental supervisor there. So, again, I want to remind you that there is both a email address, that's alphtnquestions@adph.state.al.us, or you can get that by going to the Public Health Training Network website and sending in your email questions. Also, the 1-800 number is 1-800-946-6307. So, without further ado, I'd like to turn it over to Phyllis for our first session of the day.
Thank you, Tim. I'm grateful to be here, and I'm going to talk about cottage food laws. As we all know, that went into effect this past June 1st. Again, my name is Phyllis Finn, and I am a standardization officer with the Bureau of Environmental Services with the Health Department. And we are going to talk about our objectives today. We're going to review the cottage food law, the definitions. We're going to describe cottage food operators' responsibility and the health department's role and responsibilities, and then we'll discuss a few frequently asked questions. First of all, the definitions. A cottage food production operation, what it is not. It is not a food service establishment. It is required. It is not required to have a food service permit, and a cottage food operation is not inspected by the health department. A cottage food production operation is a person operating out of his or her home who meets all the following requirements. 1, they produce a baked good, a canned jam or jelly, or a dried herb or herb mix, or a candy. The criteria in the cottage food law is that their production of their products does not generate more than $20,000 a year from the sale of their food, and they can only sell foods produced, the foods that they produce are sold directly to the consumers. The definition in the Cottage Food Law of a baked good includes cakes, breads, danishes, donuts, pastries, pies, other items that are prepared by baking the item in the oven. A baked good does not include a potentially hazardous food item as defined in the rule of the department. In the Cottage Food Law, department is defined as the State Department of Health. And in the Cottage Food Law, home is defined as the primary residence that contains a kitchen and appliances for common residential use. So we've already had the question come in, what if somebody wants to put in a commercial kitchen in their home? And that's not the intent of the Cottage Food Law. It's, like I said, the definition is appliances used for common residential use. Cottage food operators' responsibility. In the law is written that there are a few things that the cottage food operator should do. And the first one is they should complete a review form for their cottage food operation with the local county health department. And they are required to take and pass a food safety course, and it's their responsibility to maintain certification. Another responsibility that the cottage food operator has is they are to label all foods the operation sells. And again, the sale of foods may not exceed $20,000 per year, and the cottage food operation may not sell food over the internet. Again, more responsibility for the cottage food operator is the food handler course offered. They have to attend and pass a food handler's course. And acceptable food safety courses are any of the nationally accredited programs like ServSafe, National Registry, Thompson Prometric, and there's another nationally accredited food safety course that's come to light, and that's the Learn to Serve. All of them offer basic food handling courses. They don't necessarily have to take the manager's food safety certification that we require for the restaurants. But a basic food handler course. Another avenue that they can meet this requirement is our Alabama Cooperative Extension Service has actually developed a course specifically for cottage food operators. That course is acceptable. And I believe the Alabama Cooperative Extension Service, their certificate is good for 5 years. Label requirements, just to get a little bit in depth on the label requirements. Like we said earlier, the cottage food operator is required to label all of their products, and that label should include their name and the address of the cottage food production operation and a statement that the food is not inspected by the health department. Okay, now the health department's responsibility. The Cottage Food Law states that neither the State Department of Public Health nor a county health department may regulate the production of food at a cottage food production operation except as provided by this Act. This means that the health department will not inspect home kitchens. This means that the health department will not issue permits to the cottage food production operation. And the department, it does make a provision in the law that the department may issue a stop, sale, seize, or hold order for any food suspected of being the cause of a foodborne illness. And the Cottage Food Law states that the department shall promulgate rules requiring a cottage food production operation to label all food that the operation sells to consumers and requiring completion of the food safety course. So therefore, we have the review process. So if anybody asks, why do I have to do the review process? If a cottage food why do I have to come to the health department? Because it's in the law. I mean, we've been tasked with promulgating rules. And so we have the review form. And the review process is very simple. The cottage food operator would bring in a copy of their label and a copy of their certificate. And the health department environmentalist would review the sample label, review a copy of the food safety certificate, review the products that they are intending to produce and sell, and they may point out that on the review form that there is a line that says no internet sales, there's a statement that says no internet sales, and then they are to sign the review form. The environmentalist, there's a square, and I have a sample of the review form. There is a line or a box on the form, a place for the environmentalist to sign and date, and then the environmentalist can assign a review number, and the date of expiration. There's a blank for that, and that expiration date will be when the food safety certificate expires. After they fill this out and after the environmentalist signs it and assigns a number, then the environmentalist can make a copy of that review form and give it to the cottage food production operator. Okay, frequently asked questions. Is a food handler's course, which has a 3-year renewal, sufficient, or must the operator take the food manager's safety course, which is a 5-year renewal? I've already answered that. The food handler's course is sufficient. Or if they want to take the course offered by the Alabama Cooperative Extension Service, their certificate actually is good for 5 years. Can a helper, such as a child or spouse, have the credential as long as they also live in the house? The cottage food law is pretty specific. It mandates that the cottage food operator should be the one that takes and passes the food safety course. And the question has been asked, what if, is it going to be similar to like what we have for food service operations, where if they take the food safety class and they don't pass, that they're still certified for 1 year? The cottage food law does not make a provision for that. We're going strictly by what the cottage food law mandates, and it says that the cottage food operator has to take, attend, and pass a food safety class. All right, let's see. I think I've already answered that. Okay. Will the health department have a database to keep up with those operations across the state or county-wide, or at the very least keep up with how big this group will become? And right now, we do not have a statewide database. I think that Jamie Medley and Area 1, those folks have come up with a program, and they're passing it around the state for, it's an electronic form of keeping up with who has signed up to be a cottage food operator. And the question has come in, is it, do we let them know that their certificate is expired? And it's not our responsibility. That's their responsibility to maintain their certificate. Okay. All right. And we recommend that when the operator comes in and they fill out the review form, that you file it, or that you have some system of keeping up with it. It'll just save you in the long run if you have some kind of list. That way, if you get a call, like a complaint, that somebody is operating, you can look at your list and you can see that they're already, they've already come in and filled out their form, and they've got all their ducks in a row. Can a cottage food operator advertise their products on social media? The answer is that the cottage food law does not prohibit advertising. So yes, the answer would be if they want to put their wares on Facebook or any other social media, there's nothing in the food law that would prohibit that. Can a cottage food operator deliver their products to their customers? And the answer is yes. Okay, under the definition of baked good, it specifies items that are prepared by baking the item in the oven. What about fried fruit pies? The answer to that is we're just taking the cottage food law very literally. The cottage food law makes no provisions for fried foods, only items baked in an oven, jams, jellies, dried herbs, and candy. Okay, those are some of the questions that have come into our department already. In the document library, you can find a copy of the review form. You will also find frequently asked questions by Health Department environmentalists and frequently asked questions that you can pass out to the cottage food operator when they come into the office, just to give them some guidance. Again, if you have any questions, Tim mentioned the venues for sending in your questions.
Okay, great. Thank you, Phyllis. As a matter of fact, I have a couple of questions, even though that it's really not the responsibility of the department to kind of keep a database and keep up with this. But I know in the law it says that they shall not make any more than $20,000. Who reviews those receipts to ensure that they don't exceed that? Because, you know, a lot of times they want to do the jams and jellies, make a little money on the side, and then if it explodes or something, is that their responsibility to apply for a higher license maybe?
Yes, there is not a provision in the cottage food law that gives us any kind of authority to check for receipts or anything like that. So I guess it's an honor-based system, and if their cottage food operator grows to that extent, then yes, they should go and talk to the public health department about having a facility that would be conducive for that type of operation, which would be a permitted establishment.
So this kind of, I guess, goes when I used to work in the county trying to track down the little old lady that was baking cakes and selling them for birthday parties. So this kind of, if they go through the proper forms and the training, they can still do that.
Correct.
Or they can do that now legally. That's
right. It's a venue for people that want to bake cakes in their home and sell. Yes, okay. It's a venue.
And I guess last question I have is, you know, we're dealing with some counties that have fee bases, some that don't. Is there a fee for them to fill out the form?
That's a good question. There is not a provision in the cottage food law that talks about a fee. As far as I know, there's not a fee, and I know that there are some counties that are checking into a fee, but at this time, I know for the state, there's not a provision in there for a fee system.
So I guess really the only cost that they may have is attending or going to one of these food handler classes.
Yes, that's correct.
And I think it's a giant leap forward. I know some people from the environmental purists have said, well, you know, is it really safe? But I guess time will tell, like you said in your slides, that if there's any foodborne outbreaks or that type of thing that has come into play. But I do want to remind everyone that if you have any questions, we do have phone lines available at 1-800-946-6307, as well as email that can be sent to alphtnquestions@adph.state.al.us. At this time, I don't believe we have one question coming in from Colbert County for the cottage food laws. Go ahead, Colbert County. We got Colbert County on the line. Please go ahead.
Congressman, Colbert County. We just had our first application here just a few minutes before this program started. One of the questions we had.
Hello?
May have lost Jamie.
This is delayed. Sounds like this is delayed, but one of the questions we had was, even though they're advertising on social media, they have to call the cottage food facility to obtain the product, but then they go and pay for the product on the PayPal type system. Is that okay?
I don't see a problem with it, Jamie. You know, whatever form or method that they pay for it, that wouldn't be anything that we would regulate.
I had a question, if it's okay.
What, Jamie, did that answer your question?
I think I'll listen to it Thursday because I'm having a problem hearing it here. So when it replays, I guess I'll get my answer then.
Let me just say this. It says in the cottage food law that there's no internet sales. In other words, the intent there is somebody can't order online, but I don't think there would be an issue with you paying by electronic means, as long as the product is sold directly to the customer face-to-face, if that clears anything up. Okay.
And just real quickly, if anyone's having the delay issue that Jamie's having, it may be that you need to turn the volume down on your computer if you're listening at your desk. That way it'll be a little bit quicker. Hasty?
I just had a quick question. You mentioned the labeling, and it seems that the labeling is very, very simple, just basically their name and address. Is that because they're selling it directly to the consumer, so there's no need for allergens?
Very good point.
And ingredients and weight and so forth?
And that's the provision of the cottage food law that is very important, and that's why that it's a requirement that that cottage food operator maintain control. That's why we don't allow them to consign their product, because there is no information on that labeling. So if somebody had an allergen, then they can directly ask the operator, you know, does this contain wheat or does this contain nuts or so forth and so on, yeah.
So it keeps it in the first person,
right,
sort of keep the risk down. Makes sense.
And as you were talking, we're not keeping up with, Jamie said that his county just got there first. Do you know of any, like, numbers that have come in statewide? I mean, has this been something taking a lot of your time? Or?
No, it's not taken. I think a lot of people thought that there was going to be a mad rush when this law got enacted, and it's been a slow process, but it's picking up. Dr. Weiss with the Alabama Cooperative Extension Service, their first classes have been conducted statewide, and it's growing. I think more people are signing up. I think the word is getting out that there is a way for people to do this in their homes, and it's picking up now. But I think I've just been surprised, honestly, Tim, that there hasn't been the long lines to get, all the paperwork done to sell food out of your home. I think people are just, kind of watching and seeing what's going to happen, and then just like I said, getting the word out.
Yeah, and to be honest with you, when we were discussing topics for today, I mean, this was one of the first times, I'd heard, for years the buzz going around, the farmers market laws and, all this kind of stuff. And then I'm wondering if I don't know what the position of the department is about, do you promote this, or is it something that's kept quiet? I mean, what are your feels that we should go out there and, I know we're not recruiting people to apply for this, but I mean, is there some, responsibility that we have that the people that are doing this to say, hey, there's, our goal is to make sure that they have the proper training, that they're preparing this in a safe manner. What they're preparing and the amount that they're preparing really isn't our responsibility. But I guess from the food safety side, I think it would be a good idea. I mean, is that kind of the thought of the department?
Well, we're not advertising or anything like that, but I think it's nice that when somebody is, quote, caught baking and selling out of their home, that we have a way for them to do it and not be illegal. There's a way for them to do it and be legal, and so that they're not going to be shut down by the health department and all that. There is a way for them to do it the right way, and I'm very thankful. There's a lot of cottage food laws in the states that surround us, and I'm very excited that there's a provision in our cottage food law that does require some food safety, even the minimal food handlers course, that there's some introduction into food safety, which is great.
Right. And I'm glad you mentioned our State Cooperative Extension Service. I mean, they've long been a partner with us, and for us to have that relationship kind of helps not only us to get our food safety message out there and having the people that purchase these products to be safe as well. So, okay, at this time I'd like to take any other questions that we may have either by telephone or email. We're running a little ahead of schedule, but I would want to give everybody an opportunity because we have the expert here with us today, and if there are any questions, we could entertain those at this time. but I believe we're call free and email free at this time. As I said, we are a little bit ahead of schedule, but what I would like to do is go ahead and take that break. There's probably a few of you out there that need that second or third or fourth cup of coffee. So if you would, go ahead and take a 10-minute break. I've got about 9:30, so we will reassemble at 9:40 and be educated on our individual that went to the NEHA conference in Las Vegas. So we'll take a break now and be back at 9:40. Welcome back, everyone. I hope we had an enjoyable break. We want to get back to the action here for the Alabama Environmental Health Association summer chapter meetings. We do want to clear up a little bit of miscommunication or some confusion about this program today. We had intended to do this via satellite, which I think most everyone is on satellite now, watching at the 5 locations across the state. This is not being broadcast video telecommunication conference-wise, but we did have some confusion, and there were a few folks that were unable to get on early with the program. So what we're going to do right now is remind you that we have a 1-800 number to call in for any questions. That's 1-800-946-6307. And we're also accepting email questions at ALPHTN, questions@adph.state.al.us. Phyllis has agreed to recap briefly some of the items for those of you who may have missed the beginning of her session.
Well, what we talked about earlier is I was tasked with presenting the cottage food law. And you may already know that that went into effect June the 1st of this year. And what the cottage food law does is it allows a person to prepare certain items in their home and sell to the public. And the cottage food law limits those items to baked goods, jams and jellies, dried herbs and herb mixes, and candy. It does not allow for the sale of what we would call potentially hazardous food, or the new term that's in the new code is time temperature controlled for safety type foods. But it does allow for the sale of certain things to be produced in a person's home and sold to the public. And so there's a law that's created a venue for somebody that bakes cakes and wants to sell them to be able to sell to the public and do it without violating public health laws. There are some certain specifications that the person has to meet, and one is the sales of their cottage food operation are not supposed to generate more than $20,000 per year. And so if somebody is making cupcakes that are so good that they would generate more sales than $20,000, then they need to go ahead and get a permitted facility and work through the health department to get an establishment going. The other requirement is that they have to label all of their products. And the label, in the cottage food law, there's a requirement as to what is supposed to be on that label. And it's supposed to have the cottage food operation name, the cottage food operation address, and a very important statement that lets the consumer know that that product was not prepared in a kitchen that's inspected by the health department. So it's sort of like a little buyer's beware type notification on the label. And the cottage food operator has the responsibility to contact the health department. We've developed a review form that the cottage food operator should fill out, and it's very basic, a very basic review form. It's just their name, address, and the products that they produce. And so if they list on this line of products produced that they're making pigs in a blanket or something that we would consider potentially hazardous, then that's where we would catch that, and we would just let them know that under the cottage food law that there's parameters that they're only allowed to do certain things. And then they would have to supply the environmentalist a label so that we make sure that their name and address and the information that's required on the label is present. And then the other thing that the cottage food operator has to do is attend and pass a food safety course. And I'm very, very excited that that is part of our cottage food law. There are people that may not know basic food safety, and the class is very good. I've actually got to attend the course that's offered by the Alabama Cooperative Extension Service. A very good basic food safety class. So they are supposed to supply a copy of their certificate just to show the environmentalists that they have attended and passed a food safety course. And then the other stipulation to do to be able to conduct a cottage food operation is there's no internet sales. They are supposed to maintain control of their wares from them to their consumer. And so then they sign it. The environmentalist, there's a place for the environmentalist to sign on this review form that they have reviewed the label, their food safety certificate, the products that they're producing, the date, and then they assign the cottage food operator a number. And there's a spot on here for an expiration date, and that expiration date just simply correlates with the expiration date of their food safety certificate. Then the health department environmentalist would make a copy of this form and give it to the cottage food operator. That way, if we've already had calls coming in from cottage food operators saying that they have to have something to show the tax assessor, business license office, something from the health department that they are permitted to sell, and so this has helped the cottage food operator get their business license. And let's see, what else? Just to recap, several questions have come in. Somebody called in a question, can somebody pay by PayPal? And the cottage food law prohibits internet sale, but the intent there is like you would not mail that stuff like over the internet. But I don't think there's any thing in the cottage food law that would prohibit payment coming electronic. So again, that law became effective June the 1st. Let's see what else.
Phyllis, I have a real quick question since you were just mentioning about the inability for them to use social media or internet sales. Is there any prohibition to interstate commerce?
Well, that question actually has come in, Tim, and somebody is going to like a little festival over the state line, and we're bordered. We have a lot of people that live in counties that are right next to other states, and that question has come in, and that's a very good question. And this cottage food law is a state law, so it's not national, and so a cottage food operator, if they want to participate in a festival that's over the state line, they would need to contact that state and see what their allowances are for items made in a home.
I got you.
Very good question. Let me mention this. In our document library, we have the review form is available there. We have frequently asked questions for the health department officials, like just guidelines on what to do, and we have a good frequently asked questions guidance that you can actually pass out to the public. So, do you have a question, Trina?
Yes, a question came in. Does internet sales include orders received on Facebook or via email?
I believe the intent there is that the cottage food operator maintain control of their wares to the consumer. And so if they get an order in, I don't think the issue is that. It's that this is a product that is not under FDA provisions of labeling, like nutrition, allergens, and all that stuff. And so if the order comes in on Facebook, I mean, it says in there there's no prohibition about advertising. So they can put on Facebook that they make cakes and, buy my cakes. And so I'm sure if somebody messaged back, oh, I want a cake, then there's, how else would they know? I don't think there's any nothing against them taking an order electronic, but I think the delivery process needs to be in person. That's the intent of the cottage food law. And like Hasky asked earlier, what about allergens? Well, if the person is delivering those goods in person, then the person that has an allergen can ask the person directly, does this contain nuts, or I'm allergic to eggs, or whatever the case may be. Then that person can answer the questions directly.
We have one other question.
Okay.
Discuss sales off premises. For example, operating, setting up a booth at Lowe's.
Yeah, there's, as far as they can sell their wares, if Lowe's will allow them to set up. I mean, we have cottage food operation, there's not anywhere that's in the cottage food law that prohibits them from selling somewhere, as long as they maintain control of their product. There shouldn't be an issue.
Is there any, general food protection that needs to be done at that? If we're talking about a booth outside of Lowe's, I mean, does that have to be under a tent, or do the cakes have to be covered, those type of things?
Well, yeah, any food safety any food safety would apply. Hopefully they would be wrapped items, yeah. We wouldn't want just a basket of cookies out there. But as far as them selling, there's no restriction, I guess, as long as they maintain control of their food where they sell. Now, Lowe's might have something to say. Of course, they would have to get permission from wherever they go. And I'll say this, because the question has come in about temporary events. Can they sell their wares at a temporary event? Each temporary event has a sponsor, and that sponsor sets up the guidelines. Like when I was in a county, we had an annual festival every year, and the sponsor over that can say, we only want permitted establishments coming in. That's their, if they're sponsoring it, they're the ones in control of that. They have the say. And so it's up to the cottage food operator to find out what's allowed at that event, or what may or may not be allowed, at whatever venue that they choose.
Phyllis, I have a quick question.
Mm-hmm.
How does this affect bake sales? Does everyone who participates in a bake sale as a fundraiser, do all those individuals individually have to be permitted, so to speak?
It did not change the definition of, well, let me just say this, where the cottage food law portion will fit into our food code is under the definition of food service establishment. Okay. And when you read that definition, it will say what's exempt. Okay. And so that part, like churches that have bake sales, that did not change. So if a church wants to have a bake sale, they're a charitable organization, they do not have to all go out and get cottage food operator, review things. Very good question.
Since we're talking cakes, and I am a connoisseur of cakes, I happen to like the lemon meringue pies. Now, you mentioned, the fried pies and all that, but I know with the meringue, a lot of times they have raw egg. Mm-hmm. Is that something that, I guess when we review, Aunt Sally's, the list of stuff that she's going to make, if she says I make a meringue pie or something, that's when we would say, and hopefully she learned that in her food safety class as well. Mm-hmm.
Well, in the definition of a baked good, it says stuff that's baked in the oven, and so if it's not baked in the oven, then it would not be allowed.
Gotcha.
As far as baked goods go, now there's candies, that might be something you melt and pour up and stuff like that, and there's herb mixes, jams and jellies. But if it's an item that's not baked in the oven, then it would not qualify.
Excellent.
Okay.
And I thought about one more question.
Okay.
And hopefully this will be easy. As an inspector, as an environmentalist, and we encounter someone on the street that is selling their baked goods, will they have documentation to show that they've gone through that review? Is there a card? Or how is it, do we use our own information, our own database, or will they have something on them to say, I've gone through this process and I'm approved for this.
Yeah, that's why I recommend after they fill out the review form that you make a copy of it and give it to them. There's not a permit per se.
Or a card.
If you miss the beginning of the cottage food presentation, there was a slide in there that just kind of reiterated that this is, we won't go to the homes and we won't inspect, and they're not permitted.
This would be more just for
this is the
information
only,
for the inspector.
this is all they'll get from us is just a copy of their review form. Very good question. And so that's why I also recommend that the counties keep up with a list of cottage food operators, so that, because it's going to happen, that I've already had it. I've already gotten the complaint at the office that so-and-so is operating and they haven't gone through the proper cottage food operation requirements. Well, I forward that complaint to the appropriate county. Well, they can look at their list and say, oh yeah, Nancy, she has. That person that's complaining just doesn't know that she has gone through the proper procedures. So, and if Nancy hasn't, then the inspector can just let her know that there is a way for her to do this legally, and that she can sell her chocolates under the cottage food laws. Yeah, very good question. Trina?
Another question came in. Does the provision prohibit cake icings that contain butter or cream cheese, since they are considered potentially hazardous foods?
A lot of those icings are not really potentially hazardous. I know that there's butter in it, and I know that there's cream and stuff like that, but there's so much sugar, and the sugar basically renders that icing a non-potentially hazardous food or a non-time temperature controlled for safety. Good question.
Excellent.
All righty.
And I have one last question, and I got this from looking at the form. Looks like it was very well done, but it says in there about the review of the label. Are county staff going to be, I guess, trained or educated on, all right, this is what you look for in the label? Because from what I understand, it's different than like the label on the back of a cereal box.
Yeah,
correct?
The label is very simple. It's basically name, address, and then the statement. The label it is just very straightforward. Like we've already mentioned, it does not have to list nutrition or anything like that. It does not have to list allergens. But the name and address is very important, so that in the event that there was some type of foodborne outbreak associated with Betty's Cookies or so forth, we would have a source to get in touch with that person. Yeah.
And as far as complaints go, do we have the ability to, let's say, I'm eating that cake and there's a metal shaving in the cake. Is that something that public health would then go in and follow up on that complaint as well, or is it just foodborne?
No, it's just foodborne. If somebody has a problem with something that they've made, it's not inspected by the health department. We have no jurisdiction with that cottage food operator, so it's basically buyer beware. And I've already not in our state, thank the Lord, but I've already heard the stories from people I've met in other states of the chicken bone that was found in the brownies and the this and that and stuff like that. And it is, it's buyer beware. And so if there is an issue, they would go back to that cottage food operator.
So beware chicken flavored brownies.
And a chicken bone in my room. Wow.
Yeah.
Trina?
We have one more question from Area 8. They want to know, what about cheesecakes? Are they okay? They are baked.
They are baked in the oven. Yeah, it says in there. I mean, it even lists Danishes and stuff like that we know has got that. But again, I believe the sugar is going to be our saving grace in those type things. Yeah.
Okay. Well, thank you so much, Phyllis. I think that was very well done, and that's kind of the intent of what we're doing here today, is that everyone in attendance will hear the same answer from the same expert. So I do appreciate all the email questions, and encourage you to ask our next two presenters. Moving on, though, we are going to get a presentation right now from our president-elect, Ms. Hasky Bryant, who attended the National Environmental Health Association annual conference in Las Vegas back in July. One of the, I guess, benefits prior to the year of planning our annual conference is that our president-elect is sent to the national conference to represent us both in meetings as well as in training. And for those of you who've had that opportunity in the past, it's quite impressive to be at a conference of that size with like-minded individuals. So I'm going to turn it over to Hasky now for her report.
Okay, great. Thanks a lot. Like you said, this is a NEHA 2014 update. I did attend the annual education conference. It really puts it into perspective how big our field is, and gets you from that our thinking where we're local to a national, and as I'll talk about, it's actually internationally thought about. But as like I said, I'll be talking about that more. Most of you know I'm Hasky Bryant. I'm with the Jefferson County Department of Health. I am the AEHA president-elect. And like I said, this year I was fortunate enough to go to a conference not in Kalamazoo, but in Las Vegas. And as it says, Experience Energy, Las Vegas was very energetic. We did a lot of people watching there. I'll show you some pictures, but it was a lot of fun. And also we got a lot of information as well. This year, the annual education conference, as you'll see, is just a broader scope of what we do locally at our annual education conference. It's the same thing, just on a much larger scale. The agenda included educational programs, both current and cutting-edge topics in environmental health. Had a lot of exhibitors, networking opportunities, a lot of networking opportunities. I attended a focus group with the UL and also affiliate meetings, which were really helpful because I got to see how other regions are operating and the problems that they're having and their challenges, and how we can use that information to jump over to where we are and the problems and challenges we're having as well. Like I said, this was an international conference as well. The IFEH is International Federation of Environmental Health, and I believe there were actually 49 delegates at this conference from other countries. It was neat. We got to hang out with people from Australia, and you really get a world view of the environmental issues that are out there. So it was a great location. The top left is actually the hotel that we stayed in and our pool. Those are my feet, as you can see. That was a little downtime. So, but it was a great view from the hotel and the pool. To the right is actually the lobby, and those columns were pretty cool. They were actually videos, and at any given day there would be some other video running, and it may be people, maybe you had clothes or maybe didn't have clothes on, and there were light bulbs or just all kinds of cool things on those video columns. So while we're there, obviously had some great views. To the left, that's Lake Mead. I don't know for those of you that have actually gotten the opportunity to see Lake Mead. It's really, really neat. And you can see it's very small, but that's a marina. And I read actually that marina that we visited had actually been moved because it's the level is so low. It's actually, I think, 39% full right now. And some people have actually been writing that it could even be empty by 2021 maybe. At this, of course, there are people that blow the alarms, but it is pretty scary. And I know from the airplane, you have a good view of it, and you can see the white bathtub ring that everybody hears about, that are mineral deposits around the edges. But we actually drove off the road to get to the edge, and you just basically drive across the desert to get to it. It's really interesting. To the right, obviously Hoover Dam. It was beautiful as well. Those are some pictures off of the Hoover Dam. I made a comment. It seemed like all the pictures we took were postcards, like you could have bought in a store somewhere, and they were just on our camera phones. It was really, really neat. These are views off of the hotel. Once again, like I said, these are pictures that we took. The bottom left was my room. So it is a big opportunity to, I hope people will think about stepping up and becoming, trying to work your way up through the board, because it is a good opportunity to go and see, and go to the NEHA convention and get to visit these locations. So I think some of you will recognize April, Rachel, and Holly. This was after our banquet. To the right, those are some vendor exhibitors. I'm hoping that we can use some of these ideas and bring them to our own annual education conference. We did walking luncheons with the exhibitors and got to actually network with the exhibitors and learn about the products and learn about cutting edge topics and technologies that are out there that can help us do our jobs better. Here were some programs. This was actually the keynote speaker. And of course, Elvis, if you were worried, Elvis is alive and he's in Las Vegas. So in case you were worried, he's there. He's doing well. So of course, it wouldn't be Las Vegas without some Elvis impersonator. And okay, so some of the programs that I saw, I'm going to talk about in a little bit, but there were a lot of different tracks to follow. It really didn't matter what you're interested in environmental health. You could find something and pick up on it and really learn a lot there. There were tracks, and Tim will be able to help me with this, but tracks in child care, there were tracks in disaster management, preparedness. There were tracks in with food safety, and so forth. Did you have a question or anything?
We just got a quick question from from Steve McDaniel. He wants to know, did you meet Wayne Newton?
No. Wayne was not there that day. Elvis took his place. I actually didn't even see a Wayne Newton anywhere, a sign even for Wayne Newton. I'm kind of surprised. No, Wayne, sorry, Stephen. Wayne was not there with me. But different tracks, like I said, it didn't really matter what you were interested in when it came to environmental health. It could be air quality, water, whatever. They had a little bit about everything. Some new news with NEHA for NEHA members. Nelson Fabian, and I don't know if you remember, but he actually spoke for us at one of our conferences. Is stepping down after 31 years as executive director of NEHA. Tim Hatch stepped up after he stepped down as NEHA First Vice President, Region 7. Go Tim. Congratulations. Region 7 actually includes Alabama, Florida, Mississippi, North Carolina, South Carolina, and Tennessee. So it covers a lot of... Really? Sorry. Georgia, too. Sorry, Georgia. He's also IFEH Director, Disaster Risk Reduction for the Americas region as well. So he's gone global on us. He's bigger than we are now. Wow. So I know. Yeah. So we are sitting amongst a star, in case you didn't know. We're sitting amongst the famous. Alabama was very well represented at the NEHA conference. Tim presented on international affairs of emergency preparedness. Tim, did you want to say anything about that, or do you want me to?
Well, it was a long time coming. I know a lot of you have spent some time up at the Center for Domestic Preparedness in Anniston. For years, there was a course up there, environmental health training for emergency response, and we had an opportunity through a PhD student from Australia who showed some interest through the CDC, and I was asked to go over to Australia to present some of the environmental health training that we do here in Alabama. And the gentleman sitting there to the right is soon to be Dr. Ben Ryan, who actually was here in Alabama back in July, presented here at the State Health Department as well as up at UAB. And we've done this training over there, and it's kind of the sharing the love type project, is that the Americans are looked at globally as being top-notch for a lot of things, and environmental health is certainly one of them. So we've taken the class that many of you have participated in across the pond, so to speak, and so we did a presentation on the process in doing that, and then Ben followed up by how they've kind of taken the ball and are doing a very similar class over there in the Asia-Pacific region. So they've branched out to Indonesia, Papua New Guinea, Fiji, and New Zealand. And right now we've got some partners in Japan that are looking to pick this up as well. So definitely a win for the CDC and environmental health, and I was just lucky enough to be asked to participate.
Yeah, I think I even saw a slide where Malaysia was included, and one interesting point that I saw in that presentation was that you know, we're used to the resources we have. We take for granted all of the resources in planning and preparedness, training that we have. But then when you go to another country, you know, you realize they're having to start at a different place than we are. You know, we're starting from a place of clean water, wastewater systems, good wastewater system, good sanitation. They're starting from a place where they may not have wastewater systems in place. They may not even have clean water. So it's like, how do you start from a different level? And so you're taking our information and applying it to what they have and what's available to them. And I thought that was really interesting.
Right, and specifically here in Alabama, you know, we have, being the victims of circumstance from, you know, back in 2004, starting with Ivan and Katrina, and all the hurricanes that we've had up to today, as well as, you know, the tornadoes we had in 2011, and dealing with freezing temperatures. So, you know, unfortunately, Alabama's pretty good at environmental health issues and disasters. So I think they do, I say they, you know, worldwide, they look at some of the examples that we've had in dealing. So I'm just waiting now on the locusts. So.
Yeah. Maybe we'll be ready for them.
Yeah.
You know? So yeah, it was really interesting, and Ben was really nice, and really, like I said, brought a world perspective that I didn't already have. So, all right. Furthermore, Craig's out there, hopefully listening and watching us. Here's your attaboy. Craig represented us and presented on facilitating child care safety through comprehensive child care regulations. I'm not sure how much the state knows about it, but Jefferson County a few years ago actually developed and implemented our own child care regulations. And it was interesting because it filled a gap where church daycares are normally exempt. They're no longer exempt from these regulations. So it really stepped in and sort of filled a gap. So we're still tweaking it, obviously. With any large set of regulations, they've got to be tweaked and refined to the point where they're, you know, very enforceable and well done. But it's really come a long way, and I think it's really going to be good in the long run for us. April represented us. She received a Decade Scholarship Award. As you can see right there, she's receiving it. For everybody that's a NEHA member and is interested, every year they offer this. Decade is a company, I believe, that works on technology. And they offer this. You basically do an essay, and you have the chance to win a monetary scholarship to help you attend, to help with your expenses. So it's definitely worthwhile. So talking about the AEC, a lot of it was you sort of, as you're going through the different tracks, you start seeing like common threads. You start seeing common, I don't know the word I'm looking for, but basically you start seeing these common threads in all of the different areas. First of all, times are changing. Of course, we all know that we have greater responsibilities with fewer resources, and so a lot of the sessions were geared around how can we do our jobs better with less, and of course we all want to know that. And I don't know y'all that have read the Environmental Journal from back in January and February 2014, but the Florida Environmental Health Association did a presentation on the changing work environment of inspectors, of environmental health inspectors, and basically if you read it, if you have a chance to read it, you could stick AEHA on it. And I mean, I think probably it would transfer to any state because we're all sort of feeling the same pinches and the same challenges. And what they say is that, you know, we need to learn, first of all, to speak the language of the next generation environmentalists. So you see a lot about up and coming technology, technological tools so that we can do our jobs better. Another thing I heard a lot about was that environmental health has become a behavioral science, and I'll talk a little bit more about that from one of the sessions that I saw that the FDA put on. And also getting the message out to the public about, you know, what is environmental health and what are our roles in public health. they found that basically a lot of times the public doesn't really know what we do, or what environmental health is, or who's responsible for protecting it. So that was interesting too. So the annual environmental conference this year was geared towards educating the environmentalists on facilitating healthy environments, learning to work smart. We all hear about working smart but not hard, and also doing that most good with fewer resources. The agenda I talked about earlier, it covered topics from all sorts of disciplines of environmental health. The environmental health and disaster management I talked about with Tim, in training, for training and awareness, protecting and improving environmental health by influencing policy, advocacy techniques and approaches. That's a big title, but it was interesting. I went and saw that session, and it talked about who are the stakeholders in influencing a policy. And from an environmentalist standpoint, we're basically the foot soldiers. We're out in the field, and we're seeing what works and what doesn't work, or where the gaps are. And how, as environmentalists, can we influence policy? And a lot of times you feel like, as a frontline soldier, you don't really have that power to come back and to go up the ladder and influence things like that. But you can have influence on it, and sometimes you can influence even smaller things like protocols or standard operating procedures. So I challenge everyone to sort of think about, in your world, because a lot of times, especially in the state, it is your world. You might be over a whole county or two or three, right? So think about how you can improve your world, whether it's better operating procedures or protocols, or even influencing, speaking out and influencing a policy that could be changed. So it was funny, at the end of the presentation, you get the handouts, and we did a little worksheet on, who are the stakeholders, how do they influence it, how can you influence them to sway them to, or manipulate them. I hate to say that word, it's kind of an ugly word, but how can you manipulate them to work in your favor? But at the end, they quoted the 14th Dalai Lama, I think, and it said, if you think that you can't make a difference, try sleeping in the room with a mosquito. So if you think about it, a mosquito is very, very small, but boy, can it make a difference, in your world of sleeping or your world in general. So there's something to think about. Here's the topic, do not gamble with norovirus, prevention, control, and containment of a norovirus and outbreak in casino. Could you imagine trying to stop a casino? It'd be very, very difficult. It's something that never sleeps, it never stops. But what if you have a norovirus outbreak in it? And we all know if someone throws up in the middle of a casino, how many people have got it now? It spreads like wildfire. So that was a really interesting one too. Some other ones, public health mythbusters. This was a really interesting one. It was actually Summit County in Colorado, and environmental health specialist there, he may have been a director by this point, he was really interested in creative education. And of course they had a shoestring budget, or basically no budget probably, like us. And, we've all sort of heard the myths that are out there, do helmets really do any good? There's the debate back and forth about that. Seat belts, car seats. One of the ones I saw, and I wish I could have embedded it in here, was a video on bed bugs. Are bed bugs real? Well, of course, we know bed bugs are real, and we know all about them, but the general public really doesn't know anything about bed bugs, and if they do, it's pretty much what they've heard, or what they've been told, sleep tight, don't let the bed bugs bite, I guess. And a lot of people I actually encounter think that you can't even see them. They think they're sort of this mythical, teeny tiny creature that's so small that, that is biting you, and you just don't even know it bit you because you can't see it, So anyway, they, so this guy that was really interested in creative education came up with this idea to do research on basically 12 common public health interventions that had come about, and do really good research on it using peer-reviewed articles, knowledge that was out there among in his workplace, and then they went out and they did interviews of people on the street, saw where the myths were, and then they started. They made these 12 videos, And they did sort of a series of these videos, and they were very basic, and they were really interesting. I think he had a friend that did videos. I mean, that's how shoestring it was. But they were good, and so the one that he showed us in the session was our bed bugs reel. And it just basically just showed some interviews and then gave information about bed bugs. And I thought, that'd be something really interesting that we could do. It would be a really interesting public health campaign, and it would bring it down or bring it to the level of people on the street. And these are the things they're thinking that they worry about, especially the more you hear about bed bugs. So I know every time I talk about bed bugs out, among friends or family, everybody's always eager to hear about bed bugs, because it's something you just don't know a lot about. So anyway, it was really interesting. So so there were some topics about, as I said, the reporters are here, now what? So we've all worried about that, right? So, but anyway, just covered a huge range of topics. E-cigarettes, everybody's talking about e-cigarettes. And FDA Oral Culture Learner Project. Now this was really interesting. I don't know how many of you had a chance to see John, why do I always say his name wrong? Not Masuka. Anyway, John is in the FDA retail specialist in the Pacific region. Really good speaker. And he generally moderates at the NEHA conferences. You see a lot of him at these conferences. Anyway, they joined forces with Google of all people and their food safety people. And they came up with an idea to figure out how best to change behaviors. Because, like I was saying earlier, I mean, it basically comes down to we're changing behaviors. That's our goal, is to change behaviors. And we have become health behavioralists, whether we like it or not. So what they found was they went out, did research, and it's actually going to be published, so we'll be able to get the study. I put my name on a list, so hopefully he'll contact me when it is actually published for the whole report. But they created and developed some tools to hand out to food safety workers. And what they found was that we're a written culture, and they're an oral culture. So you can imagine where we disconnect. And why a lot of times I'm telling you what I want you to know. Everything I have is based on the written word. My regulations are written, all of the protocols, all the policies, everything are written. But how do I get them to understand that? And how do I get them to change their behaviors so that they're going to provide safe food? That's the challenge. And that's what they're trying to figure out. And they're trying to figure out how we can give them a tool so that what I'm telling them translates to how they learn. Okay, so and a lot of it came down to, they found that it's always better if you show somebody what to do. So I'm telling you, you need to sanitize your utensils. But it's a lot better if I show you how to sanitize your utensils, because maybe no one's ever shown you. Now, we require ServSafe certified managers. In Jefferson County, we require food safety classes, but that doesn't necessarily mean that they've been trained on their specific job. So, like I said, if I'm telling you to calibrate your thermometer, it's better if I show you how to calibrate a thermometer.
So many times with the health department, we have pamphlets that we want to hand out. Mm-hmm. But like what you're saying is, instead of giving them a pamphlet on the how-tos of setting up your sink, to get in there, roll up your sleeves, and actually show them mm-hmm. how to take the test kit, how to measure. That's very good. Actually,
absolutely, more hands-on. Mm-hmm. to take. Obviously, the authority's there. Mm-hmm. We have enforcement authority. There's no question about that. But to take that authority feel out of it, and now I'm just teaching you. I'm showing you how to do what I need you to do to provide safe food. Mm-hmm. So, and this comes up in all sorts of areas of food safety. Like you said, it could be setting up a 3-compartment sink. It could be setting up a sanitizer bucket and showing them how to test that. Making sure that they understand what kind of chemical they have. I mean, I can easily cite you for not having the right test strips for your sanitizer, but showing them which sanitizer test strips are right and how they look when you actually test it. There's 1,000 different things that come up like that. But anyway, so this is what they learned. They figured out that it's always better if you can show them, if you've got pictures. We do have a lot of pictures out there, a lot of resources that are really helpful. And even Spanish, if you think about it, we have a lot of Spanish handouts. They're still written.
That's right.
So you really haven't gone any further, even though we've taken the step to try to, communicate. It still is not actually bridging that gap of information from me, the written, to the oral learner. So it's a really interesting project, and I thought it was really interesting that they thought outside of the box and FDA joined up with Google, who has, of course, infinite resources, where we have very few, and the FDA has very few, to really get out and learn something about it and figure out how we can do this better, and easier, smarter, working smarter. So anyway, onward about valuable resources. I actually sent, several people contacted back. I sent out a request for everybody's information to mail you some resources that I got while I was at NEHA. I thought it was important to share the resources that I was fortunate enough to see when I was talking to all the different exhibitors. The USDA was there. And if you haven't gotten it, of course I'm going to put my information up there, and you can still email me and I'll mail you some copies. Of course the USDA is limited too, so they were only able to send me 100, and so I sent out, I think, 10 to each group or 15 to each group. And also you can order your own. On the back of the book, you can actually order it yourself too. There's a 1-800 number. You can sign up very easily, and they'll send you a box of 100. Especially now, we're lowering our requirements on, I know with the state not doing as many inspections of these events or multiple day events or whatever. So this, and even in disaster situations, whenever you have a disaster, a tornado or whatever, people come out of the woodwork. They want to help. They want to cook for everybody. They want to bring you your, their best chili, their chicken salad, everything. This is a good resource to hand people, to show people how to cook for groups, Of course, it's written, but there are some pictures too. So anyway, hopefully it'll get the word across. So that was one good resource that I found that I thought would be helpful for everyone. NSF is another good resource. They were there. Talking about food equipment certifications. There are a lot of changes and updates to equipment and what it means to meet their standards. So you can go to nsf.org, and they have a lot of information there. The CDC was handing out these handouts, and it was all kinds of subjects, whether it's the Model Aquatic Health Code, making swimming healthy and safe, e-learning on environmental assessment of food illness outbreaks. So there's a lot of information out there on the CDC website. And you can also request copies. And I sent some out too. You can make copies and hand them out. UL, I actually went to a focus group that UL put on. And basically they're trying to get the message out that they're bigger than extension cords. When you think of UL, you think of light bulbs, extension cords, electrical. But they actually certified just like NSF. They're basically a competitor to NSF. They do the same things. And actually, if you go to the UL website, they now have something called Dashboard. There's a huge resource library out there for regulators. So there's a lot of information out there. And actually, we may be calling on UL. They told me that they would actually be happy to come and speak for us. So we may call on them to come speak. Of course, the FDA's Alert Initiative. They were there passing out pamphlets on alert. Of course, another resource is if you join NEHA, you get the Journal of Environmental Health, which is a huge resource. A lot of cutting-edge information there. It's a peer-reviewed article, so it's a good resource. And of course, our most valuable resource, us, I think. I like to think that we're the most valuable resource because we're out there in the field, seeing what's going on, helping to educate the public, helping to educate the food safety or the food service workers. So I believe that we make the biggest impact out in the field. Wouldn't you agree, Tim?
Absolutely.
Okay, just wanted to make sure. So just so you know, there are some upcoming events for us as well, as a segue from NEHA, their annual education conference. Please don't hold me to these dates because they're not correct. It's actually going to be February 3rd through the 5th. And it's going to be at the Marriott in Auburn. And I know everybody remembers the surveys that went out. We're going to do this in conjunction with the state symposium, their educational symposium. We're going to use those survey results to pick our topics, pick our speakers, so they'll be absolutely relevant to what you want to hear, what you want to know. I'll do my best as president-elect and as the person that's working on these topics to keep it relevant and to keep it interesting. But obviously, you know, it makes it a lot easier if you help me by sending in your requests and sending in people that you know. I mean, it's a huge resource. Everybody knows somebody that is an expert in different fields. So if you know someone that you think would be interesting, or somebody you've heard in the past that would be interesting, please, you know, send them to me. Upcoming events, next year, NEHA will be at the Renaissance Orlando in SeaWorld, so that should be interesting. July 13th through the 15th should be super hot. And they're actually calling for abstracts, lectures, learning labs, etc. And we're going to incorporate, I'm hoping that we can incorporate some of their ideas of learning labs and such. We'll talk about that more. But the, like Craig went and did a presentation, if you have a project that you're working on, Phyllis, you're always working on big projects. You can submit them to NEHA and then have a chance to actually present to a national audience or an international audience.
And they drastically discount the registration fee for you doing that as well. So that's another avenue of cost savings.
It's sort of a perk of actually being a speaker. So here's my contact information. Like I said, if you have any ideas, please speak up. Please send them to me. I want to hear them because I want our symposium and our educational conference to be as interesting as what I experienced at NEHA, and it can be because it's still the same topics. So, and we can be as big as we possibly can by thinking outside the box and reaching out to these different speakers. So thank you.
Great, Trina. I think we have a question that's come in over email.
Yes, we have a question that's directed to Tim or Hasky. Do either of you have an idea of how many NEHA members are in Alabama and how many are environmentalists with the state?
I do know that answer. Currently, there's about 25 NEHA members in Alabama. NEHA membership costs roughly $95 a year. In that, there is monthly emails that come out as far as information, great resources. Hasky mentioned the Journal of Environmental Health. When you do attend the national conference, you get a member's rate to attend that conference. And I believe there's probably about half of those are state employees. I know there are numerous individuals that have over the last few years across the state that have earned their registered environmental health specialist certification or their credential. I know we've got about 10 of those, and then I think there's a couple more that are striving toward that right now. The credential maintenance is about $125 every 2 years, but that is a national certification that's accepted worldwide, actually, because there are some other countries that have contacted NEHA about using the REHS or RS, because some states are still calling environmental health sanitarians. So. But there are a lot of other, I say a lot, there's probably about a dozen other individuals that work for the food industry, whether it's at a restaurant, food processing, or even some environmental health and occupational health individuals that work in industry throughout the state. So about 2 dozen within Alabama. One of the things I wanted to point out, Hasky mentioned there were about 50 international delegates out of the close to 1,000 that were in attendance at Las Vegas.
A second part to that question was how do you join? Expand on how to join.
Yeah, joining is very easy. I highly encourage you all to do so. Being a member of AEHA, in my opinion, is first and foremost. I mean, because we're of like mind, we do things together. We're all in the boat together, so to speak. But NEHA has a very comprehensive website. As a member, you can go online, and a lot of the sessions that were at Las Vegas have either been cataloged via video, or the PowerPoint presentations are all available. So some of the ones Hasky attended, you can go online and either download the PowerPoints, or some that were videoed. You can see those as well. So I would encourage you to go to NEHA.org. On the left-hand side, there is a membership link. Fill out the membership, or I know Hasky and I are both members. If you have any questions, we'd be glad to help.
That's all you got? Okay.
So take these last few minutes of our second presentation to remind you all that we do have a 1-800 number, which is 1-800-946-6307 if you'd like to call in a question, or do as others have and email one in to alphtnquestions@adph.state.al.us. I've listened to a lot of annual conference reports. Hasky, I think that was one of the best we've had. I do appreciate it. Even the feet picture, you know, a little disturbing.
Well, I want you to know that I had a good time, along with my M&M friends,
yeah,
my daughter.
I think that we had about 6 people from Alabama represented, which was great. I think we were there in support of Craig, did a great job in his presentation. And as Hasky mentioned, that right now they are calling for abstracts. So Phyllis, since you're working on projects, you know, submit an abstract for the conference that's going to the House of the Mouse down there in Orlando. And the 2016 conference has already been planned in San Antonio. And I know you mentioned Kalamazoo, Michigan. Actually, Grand Rapids, Michigan is being proposed for the 2017. Wow. So not set in stone, but the next 2 years.
Could go to Kalamazoo after all.
Yeah, could never know. But anyway, so I think that's all the questions that we have at this time. As I look at the clock, I believe it is about 10:35. Let's take a 15-minute break, and at about 10 minutes till 11, we'll begin our third and final session of the day, which is going to be Phyllis Martis discussing our environmental computer program update. So let's take a break and be back in 15. Welcome back. We're here today to discuss environmental health issues in our state, and using a new platform. It's been done once before, and we found it to be successful then, and we're hoping to have a successful program today. We are broadcasting from the Alabama Department of Public Health Studios here in Montgomery. We've got 3 speakers. We've accomplished 2 of the 3. Right now, we're going to be pitching it over to Ms. Phyllis Martis, who is an environmental supervisor in the Bureau of Environmental Services, and she's going to be discussing with us the environmental computer program and what the update is as we are today.
Thank you, Tim. Good morning, everyone. I will begin with just showing you how to sign in. Those of you who are not logged in, of course, you need to do that when you get ready to enter the program. I hope everyone across the state is using the program, the on-site program. The BITE program itself, of course, has been in existence for a number of years, so I'm sure you're all familiar with that. And the programs are similar in the login and the way you maneuver through them. This is going to be a very interactive session, so I want your questions either by calling in or by sending email. Trina Parker has agreed to help us with that, so we really appreciate that. Of course, when you get ready to log in, you go to the ADPH website. You're going to go into the security portal, and you will enter your information the same way you log into your computer every day. And once you get to the environmental website, of course, you can see that one of the newest things that that has been added, and actually it's been in existence for a couple of months now, I believe, is the environmental status. When you go to the environmental status, you can enter your request. Now, I'm going to ask a favor of you all. When you enter a request, if it is for a particular record, if you could enter that record number, or I think it's called the event ID number, it would help us to see what the issues are. Oftentimes, we'll get these requests in, and they come through our email. And Jayashri will help us with it, Jayashri Janata, who is in IT, and she is wonderful in working with this program. But a lot of times there are issues that she can help you with, but without having that event ID, it makes it difficult because we have access to everything that's been entered statewide. So to look at that, we need the event ID. What you would do, if you want to look at some of the things that you all have addressed, you can look at the existing request. and when your computer decides to work with you and open up, you can actually look at the date, or you can search by who sent the request in, and of course you can also search by the county. So I'm just going to pick one. I don't know if there's anything there. We will see. And apparently there is not, so let's try another one. I know that we have gotten something from Montgomery County, so we'll search on Montgomery County. Okay. This is the way you would look for them. Apparently it does not want to work. I apologize. But what happens is when you send in a request, what we do here in the central office is we look at your request. As you can see that there are 2 pending in the web system at this particular point. What we do is review them, try to decide if this is a system issue, whereas your computer is acting up, or if it's a programming issue. If it is a programming issue, of course, we will go in, we will edit the request, we will either approve it or not approve it, depending on whether it is a system error or a web system error that we think we can address. Sometimes they're just issues where you think we need to add something. This particular one, there's a request for a CEP5. Those of you who work in on-site, you know the CEP5 is the installer certification. So this requester is asking that we have a letter in the database asking for the CEP5, because if the installer does not send it in, we cannot approve the system. This one will probably be approved. I don't see why it would not be. But I actually have already addressed it, and I asked the requester to give me some potential verbiage to use for that letter. So I will address that later. The other things that, of course, have been added, and I think all of you are familiar with that, is the county change. I don't have access to that because of my level. But you at the county level, if you work in multiple counties, you can click on the county change and you have access to whatever counties that you work in so that you can do your work in those counties. Currently, the only 2 modules that we have are the bike module and the on-site module. The food module is in process, or it's in progress. Phyllis Finn and the food people working with that. I have been able to sit in on some of their meetings, but if you have food questions, I will refer those to Phyllis Finn. And I do want you all to ask, because if you don't ask, I'm really not sure what you want. Some of the things that we actually have looked at and the things that we have addressed, I was going to show you that as well. In the environmental status, some of the things that we have approved. For instance, and this particular one was on a bite. I generally don't answer the bite ones, but I did answer this one. And the request was to print a VPL letter in the bite database, and of course that made perfect sense to me. So when this particular one was entered in error, so it was deleted. So that's what it would look like on our end. But we do want you all to continue to send those in, because that helps us a lot. It helps us to know what your issues are, because you're in this every day. So if you don't tell us, then we don't know what's going on. Another thing that IT has added, and they added this recently, and I expect it to be actually in the database by the end of the week, and it's the latest updates. It's very difficult to create a how-to document, because this is a very dynamic system, so it's changing from day to day. So it's very difficult to do a document that's a how-to manual. So to help us with that, another page in the module is the latest updates, and this module is in regardless of the module that you are in. For instance, the new and updates for this particular issue was about the bite program. There's a screen for the bite search, and the question was, what has been added new to the bite search results? And there was a request to add the county to help the person search. So that information has been added, and this is the actual screen that you would see when you go into the new updates. So it will tell you exactly what has been added. In addition to telling you what has been added, it will give you an explanation. And I will work with Jaya Cherie on this, because a lot of times, because she's not an environmentalist, sometimes the verbiage she uses may not be what we need. But I will help her with that. And this particular one, of course, she's added the county name to assist with that with that search. Another thing that's been added for the on-site program, or a question, was about changing from a new small flow type to a repair. Oftentimes when you're entering your data, you forget that it's not a repair, it's a new system, and you need a way to, without having to enter all that information again, you need a way to change it from repair to new, and vice versa. So here you see Jay Cherie has outlined it, and she tells you that you can now change a new flow type to a repair. And the reason for that was so that if you mistakenly entered it as a repair, you can change it to new. And of course, like I said, and vice versa. So these things I think will help you also. There was also a request to add the number of bedrooms to permit, and that's what we're used to, because that's what we had in Access. So she's done that, and she also gave you an explanation for why she did that. And she did that so that not only would we know the number of bedrooms for the sizing, but we could kind of look at it when the installation was going on to see if perhaps the size of the home has changed, or the structure has changed, to make sure that the system is still sufficient to support an on-site system. And guys, actually, and I do apologize for it being this brief, but those are the updates that we have. So I really would like to entertain your questions.
Just as a reminder, if you are wanting to ask questions by phone, we do have a telephone line open at 1-800-946-6307, as well as our email acceptance. Trina's waiting there with bated breath for an email question on our computerization project at alphtnquestions@adph.state.al.us. Again, I want to emphasize the fact that we do have the expert, or the person that's in charge of this project, here with us today. I've heard a lot of good things about the modules that we have up and running. One question I had is about the I guess the projected completion date. You said the BITE program's been in existence for a couple of years, and we have on-site and food is in progress. I mean, do you have a target date for food implementation, and what's coming up down the stretch?
Actually, at one point or another, we want to have everything, all the modules, everything that environmentalists use, and I think that also includes our EDAR system as well. All of that will be web-based. Our complaint database is also going to be done. The lead database at some point will be done. And Phyllis, can you tell us an expected date? Do you know for the
There's
food?
not a definite date. I know that we're in the training phase. I know that the food program has been put like on the training module, and people can go in there and kind of experiment around with it and see if there's any glitches. I know that Quincy and Atanu have been out to a couple of counties with some food computer folks and just kind of testing the waters. We've had Montgomery County environmentalists in working with Atanu, just trying to tweak the system as much as possible, obviously before it's launched. You know, we don't want to have this thing launched and have a lot of glitches and stuff like that. But I know that Atanu and Quincy and the computer staff have worked very hard, and I don't know if you know this, Tim, but we actually have video teleconferences that we've had over the last year, just trying to connect with the county folks, the ones that are actually using this program, to get our computer people connected, because it's just so much better when the people that are out in the counties can talk directly with the people that are writing the program to get the information that they need and to get it set up the way that it's user-friendly for the people out in the counties. But the shorter answer is no, we don't have a projected completion date. It's a work in progress.
Excellent. We do have a call on the line, Jefferson County. If you would, go ahead and ask your question.
We still hear it. I mean, you got to turn it down. Oh, yeah.
Go ahead, Jefferson.
Okay. I have a question about temporary events and the cottage food laws. If we have, and this actually came up a while back, right before Alabama approved, we approved our cottage food laws. I had someone from another southeastern state that already has a cottage food law, and he wanted to bring food that prepared in his home to one of our temporary events. Can we allow someone to bring food prepared out of state under their cottage food law into Alabama for a temporary event?
The intent of a temporary event is that the stuff is made at that event and sold, and that's the intent. Let me do some research on that, on how we want to handle people from out of state bringing in their cottage food. And the question came up the opposite way. I don't know if you got to hear, what does somebody that is a cottage food operator, what do they do when they want to go to another state and they need to check with that state? But for somebody coming in at a temporary event, if the temporary event is exempt, then it's sort of a moot point, because we're not going to be have any jurisdiction there. It's temporary. They're exempt. But somebody that's bringing in that stuff that's prepared in home, let me do some research on that, and I can get back with you on that one.
Okay. All right. Thank you.
Great. Thank you so much for your call. Yeah, I know we have a lot of, one of the things we want to make sure that everybody understands is that after the program, we will have this information available. We'll get the contact information for our three presenters, so that if you have questions that come up over the next few days or weeks or whatever, you can call them. Again, these are the experts on the program today, so I would ask you to reach out to them. Going back to our environmental computerization project update, one of the things I would like to just kind of say on behalf of the project that Phyllis is working on is that there's very few times in one's career that you can actually have an input on what you use on a day-to-day basis. And like Phyllis said, is that that if you are involved in the food program in your county, or if you're responsible for that, let them know what things you want to see, because this is going to be a tool that they're going to be using day in and day out. And kind of like my 7-year-old, I tell him, what do you want for dinner? Well, I don't care. So that when we have the Brussels sprouts and he complains about it, you had your time for input. So don't complain when the product is done. Right now is the time that we value the input from the county staff, because this is a project that's being done for them to make their jobs easier. Now, granted, there is a benefit from the state level of getting the data collected and ease of operation, but definitely want your input. And it sounds like from the two that are in use today, as well as the one that's in development, that is the case. So we do still encourage county level and area staff to send in those comments or concerns, and it's better to do it now in the testing phase than when it's implemented.
And for those of you who may not be aware of it, as Phyllis said earlier, you can access the food training module through the training website, the training portal of the website. And Tim asked earlier about what other programs, and you can see, even though we talk about food and we refer to it as food, when you go to the inspection module, which is what it's called, not only are you looking at food, but you're looking at body art and camps, milk, pools, and seafood, which is food. And at this point, of course, if you enter data in here and you want to issue a permit, you're going to also have to issue it into your access database at this particular point. But unless we use this database, we're not going to know what the issues and the glitches are. So you may be doing duplicate entry right now, but we need you to do that so that, as Tim said, you can't complain about the Brussels sprouts that you had for dinner if you don't tell us what the problem is. Because really and truly, if you tell us what the issues are, we're trying to input what you need to make it as user-friendly as we possibly can. And
they're going to be growing pains. I mean, exactly. Of course. I know there's been, all the counties have received new computers here lately. I know there was some, not compatibility issues, but newness issues that went along with that, but I think those have been ironed out, and it's just part of the advancement. Kind of like Hasky said, the big push nationally in environmental health programs is to work smarter and not harder, using the technology that we have available today to make our jobs easier, faster, more efficient, and then at the end of the day, as environmentalists, we're more productive. You know, I think the day's coming that you know, we go to a paperless existence. You know, I know a lot of I guess larger states or states with more funding available have gone that way, and hopefully Alabama will follow suit in the future. So at this time, I want to give one last plea out there for any questions that you may have from the 1-800-946-6307 or via email at this time. I believe we have one.
I have a question.
Oh.
It's not on email, but if a person dealing with the rabies dog bite, if a person is bitten in one county and goes to a doctor in a second county, will this program allow them, that county that they went to the medical physician, would it allow them to put their information in the computer where the other county where the dog bite actually taking place could go out and do the follow-up?
The way this was supposed to be set up, and I have not looked at the bite module because I really don't deal with it that often, but the way it was supposed to be set up initially was that if the environmentalists, let's say in Madison County, the dog bit them in Madison County, but they went to, is Marshall County
Yeah.
Okay. Yeah. And they actually, thank you. And they actually went to Marshall County to see the doctor, that there would be a way to email that report to the Madison County environmentalists so that they could do the research. Now, I have not looked into it, so I could be wrong. But that was the intent at one point, because we are also not only looking at bordering counties, but, you know, as Phyllis said, doing the cottage food law, we have bordering states. So we were also looking at that in some kind of way we could get that information also.
Does that answer your question?
Yes.
Great.
Let me just say this. I'm very excited about the web-based program, and, you know, like you just said, you know, the direction that we're going, hopefully one day, is paperless. And I'm excited to think that one day an inspector could have a tablet or some device that would have, you know, information at their fingertips, so that when they walk into a restaurant, I can look and see, pull up the last inspection. I can see that we talked about, you know, a bug problem. I can see the last few inspections. I can see the history of employees not washing their hands. And, I mean, the possibilities of having all that information in one device, and the way it would help an inspector. If you aren't sure where to mark something, you could touch that that debit, and then it would open up the marking instructions, and then it would open up the food code. I mean, just the possibilities of resources to have in one device and how it would make our job easier. I mean, it's just so exciting to me to think how much it will help us to help educate, you know. Just the possibilities are endless. I'm very excited and looking forward to progressing. Yeah.
I'm glad you mentioned that, Phyllis, because we actually have a pilot program. We don't have it. The area actually has a pilot program, and they actually have some iPads. So that right now they are doing some on-site, since that's the only one that's actually really up and working, with the exception of Bike. And they actually have some tablets where they are doing a pilot program, so we can see how well the environmentalists can do even the on-site and draw out the systems in the field. And not only do they have the iPads, of course, they have a printer, so they can go ahead and print out the approvals and do everything on-site, which makes us more efficient.
And you think about the ability of these new devices, whether it's using GPS, mapping, satellite photos, just the camera alone, you know, like you were saying, you know, when we talked about a bug problem last time, you take a picture of the dead roaches, and they say, well, no, yep, we did, because here's the picture that I took last time. So I think it would help us in the enforcement, as well as getting our facilities up to standard, and then with the on-site program, looking at the way, you know, we used to have to, I remember years ago, you have to carry the GPS unit with you. Well, now your iPad has that. You can use the latitude, longitude, and you can mark the lid of a septic tank, you know, and have that, you know, imprinted on your map. So that's not only good business for us, but also for the homeowners. that historically, I mean, it would take years to get this, you know, a big database, but, you know, in the sale of a house, you know, where is my septic tank?
Exactly.
Well, here it is based on a satellite photo.
Exactly.
You know, so I concur that there is a lot of progress being made, and the Bureau is putting a lot of time and effort into getting these tools for the county staff to use, and I, for one, thank you for your time in doing that. I believe we've reached to the end of our scheduled program. There are a few things I'd like to say before we end. I don't think anybody would complain about being released for lunch a little bit earlier. The way our schedule was set up today is that we're going to take a lunch break and then reassemble there at your locations for your chapter business meeting. This year we have the privilege and benefit of partnering with our Bureau of Environmental Services, as Hasky mentioned, for our annual meeting as well as the Environmental Education Symposium that the Bureau is putting on. This is going to be shortening, I guess, our year a little bit, which is definitely a blessing in that we are going to be partnering with our Bureau. But we're going to have some challenges as well, being that our annual conference will be in February and not in, you know, April, May, June, as it has been historically. One of the things I would like to mention to each of you is that during your business meeting, we do need to focus on the fact that we will be meeting again for the last week of October into the first week of November. Your chapter chairs know the dates that we will be meeting. At those business meetings, we will need to do award nominations. I know last year we had only 2 individuals who were nominated for the Mullins Award, which we do accept 1 per chapter. So please take some time and discuss the Ansel C. Mullins Award for those individuals who have been 5 years or less in service as an environmentalist at the local level. Also, our Environmentalist of the Year Award. Last year, I believe we had 4 nominees for that award. So the time frame is going to be a little shorter. So if we do the nominations in end of October, November, we're looking at having those award packets turned back in to our awards chair by the first part of January, so that we can get them graded by judges and the awards actually produced as far as the trophies and plaques and that type of thing. Also, you'll need to think in your October, November meetings about chapter elections, if you're up for those as well. And I would like to remind the Board of Directors we will be having a video teleconference meeting, board meeting, and the next one will be on September the 23rd, and that will actually be using our video teleconferencing equipment as opposed to satellite as we're doing today. So at this time, I would like to give a big thank you to Michael Smith and his crew here at Video Communications. They helped us get this accomplished today. I think it was time and money conscious that we did it in this fashion. We would also like your feedback. Any of the board members or your chapter chairs, let us know how you like this format. If it's something that we would like to do again. We did save the travel time and expense for our speakers. I'd like to also thank Phyllis and Hasky for their time today. Hasky did drive down from Birmingham, so I do appreciate your time in doing that. Trina has let me know that we do have one last question via email.
This person wants to know which area is piloting the iPad program for on-site sewage.
Actually, it's in Area 1.
Silent auction.
Yes, one thing also, we have very successful over the last few years. You know, AEHA offers a scholarship award in the amount of $1,000 for individuals who are pursuing a degree in public health or environmental health. We have been, last year was the first time in recent history that we've not awarded that, but we use our silent auction for that, and silent auction can be a lot of fun. We had a lot of good items last year, anything from sports memorabilia to maybe Christmas items that you may want to re-gift, jewelry, and even the spirits. And those of you who have bought those know what I'm talking about. So do want you to give some thought into silent auction for the February conference. We do want to start collecting those items as we speak. So without any further ado, again, thank you for your time today. I believe I'm going to turn it over to our chapter chairs there at your location to break for lunch and then reassemble this afternoon for your business meeting. So again, thank you for your time. This information will be posted on the adph.org training network site for any PowerPoints or materials that were used in today's presentation. Thank you for your time. We'll see you next time.